Genomics, cognitive computing, deep machine learning. It may sound like science fiction, but it's actually the cutting edge of today's healthcare and medical management industries. From drug discovery to population health, IBM Watson Health is harnessing the power of big data to revolutionize the capabilities of medical administrators and physicians.
While physicians, nurses, and medical technicians work the front lines of providing quality health care, an unseen army of medical practice administrators, managers, and executives provide the foundational support to keep the system running. Helping to provide revolutionary support to the healthcare system is IBM Watson Health.
Watson Health represents IBM's moonshot in transforming health and healthcare by basically translating the data that exists in health and healthcare into key insights through the power of a cognitive system called Watson. So we're having an extraordinary impact. We're showing early evidence of results.
Amazing results that are changing the way the medical industry operates, with even greater potential in the future by having Watson gather and disseminate a vast array of data as a groundbreaking new methodology tool in medicine. Watson Health provides specialized knowledge to both medical practitioners and administrators. They can solve some of the most challenging problems with Watson, which in turn analyzes data and provides insight at a speed never before thought possible.
Through the power of Watson, we have the ability to read structured and unstructured data that could be in an electronic medical record, it could be in a medical journal, it could be in a textbook, and bring basically insights to that healthcare professional, to that policymaker, to that hospital administrator, and promote a broader sense of health that goes beyond healthcare.
Healthcare is becoming increasingly data-driven industry. When it comes to data, management of data, making sense of that data across the board in healthcare, cognitive will play a role in there because everything has to do with what insights could be extracted from data and how you're informing that point of decision making. No matter is hospital operations, no matter is patient management, no matter is producing a particular outcome for that patient that you're actually seeing.
Watson's ability to make data available from facets of healthcare is especially appreciated by physicians and medical researchers.
Watson has been an awesome tool to add in to a patient experience and to a clinical decision-making process. It's really gone from this great idea, this really cool tool, to something that is practically being used in the exam room with patients when they're newly diagnosed, for example, with lung cancer in our lung cancer clinics.
By using Watson today, the precision and the accuracy we have is so much greater than manually the approaches we used to do. And it's more efficient, time-saving. It not only is fast, but it also reduces the labor intensity at the site. It allows those site study staff to focus on other activities.
The feedback so far we've got from health professionals is some of them, they say that this is essential. I cannot imagine health being delivered and done in the future without these kind of technologies, because we cannot cope with the amount of data, amount of knowledge that is being thrown at us. And you want to be sure that it's the best care that is delivered to them, backed up by evidence and data, and doing it at scale in the short amount of time.
However, a key benefit of Watson is also its ability to provide crucial data to administrators and managers.
I think Watson has many benefits for hospital administrators and executives. One example that comes to mind is that we had a very large health system with multiple hospitals who is having difficulty measuring the performance. We were able to deploy technology from our value-based care business that actually showed measurable improvement, 55% productivity to be exact, which literally helped that very large hospital system have savings right down to its bottom line. Our entire premise for deploying our technology is that we can't do it alone. It has to be in partnership with the entire ecosystem and all of the stakeholders, including the people and patients within it. We work very closely to identify the problems and challenges that they face.
MGMA's Frontline Healthcare Leaders Program is essential for us to work with as we look at the potential and the power of Watson, as we look at the potential of a big data stethoscope to help leaders like you look at ways in which you can leverage your data, that as a natural resource, into key actionable insights. We're excited to find ways in which you can help us train Watson, teach Watson, to bring those insights that are relevant to you, to bring better health outcomes at lower costs to the populations you serve.
Healthcare is rapidly evolving across the US and around the world, and IBM Watson Health is dramatically helping to lead the way there. In Cambridge, Massachusetts, I'm Tim Estilos.